One of the most important aspect about anesthesia is patient safety, which is of paramount importance to us. Hence, the job of an anesthetist is compared to the job of a pilot of an aircraft on many occasions. To go a little bit into detail about this, an induction of anesthesia, which is basically patients being put to sleep, is similar to flight taking off. Maintenance of anesthesia, where the surgical procedure is being performed and an anesthetist looking after the patient, is akin to flight cruising at high altitudes. Similarly, patient recovery from anesthesia is similar to flight landing. Hence, the anesthetists need to be vigilant throughout the procedure to provide safe and high quality care to all his or her patients. In VS Super-Speciality Hospital, we are equipped with state-of-the-art anesthesia machines, monitors, syringe pumps, etc., which helps us in providing safe, high quality and appropriate anesthetic care to our patients. In addition to providing safe anesthesia care, we also ensure that our patients get adequate post-operative pain relief, which helps in getting these patients up and about back to the normal daily routine without much of pain. We have 24/7 resident senior anesthetic registrar available in the hospital to cater to any anesthetic emergencies which may arise. And this is in addition to a senior consultant anesthetic cover 24/7. As we all know, when a patient gets posted for a surgery, one of the significant concern they have is about anesthesia. What's going to happen to them under anesthetic? Who's going to look after to them during the surgical procedure? In VS Super-Speciality Hospital, our anesthetic team is involved in the whole perioperative period, as I mentioned earlier. During the preoperative visit to see our patients, we go and sit with the patient, explain to them what's going to happen in detail in the whole perioperative period. We give them options of various types of anesthetic choices, explain to them it's a procedure of the anesthetic choices and the complications associated with that. We involve the patient in the decision making. After they have been fully aware of what anesthetic technique we are going to do, and they agree with what technique we have decided, the anesthetist goes on to perform the procedure. In simple words, we ensure that patients are involved in decision making fully to the core, so that they are all comfortable with what they're going to expect in the operating theatre. In VS Super-Speciality Hospitals, our anesthetic team can provide safe, high quality and appropriate anesthetic care for complex surgical procedures of varied surgical subspecialties. We can look after patients of different age groups ranging from neonates to very elderly geriatric patients. In addition to the skills normally expected of a modern day anesthetist, we are equipped and skilled to use various gadgets like ultrasound machine for performing peripheral nerve blocks and vascular access, use of fiber optic intubating laryngoscopes and other new airway devices like video laryngoscopes for patients having difficult airway, to name a few. So to conclude, patients undergoing surgery at VS Super-Speciality Hospital will receive a safe, high quality, appropriate care for the surgical procedures with no compromise whatsoever, with patient safety being our primary goal at all the times.